Quitting smoking is one of the best things you can do for your health. Quitting is hard, but the ChristianaCare team is here to help. Joining me today are two representatives from ChristianaCare, Nora Katurkis, the Cancer Outreach Program Manager, and Denise Taylor, the Project Manager for Tobacco Cessation. Thank you both for joining us today.
Thank you for having us.
So before we dive into the details of the program, let's talk about the health risks of smoking.
Well, let me take that one, Denise. We often talk about that lung cancer is the one thing that we worry about with people who are smoking. However, we do know that there are other cancers that occur that sometimes we don't think about. Head and neck cancer, bladder cancer, just to name two, cancer of the tongue. We also forget that, circulation is a problem, bone density is a problem. And individuals just don't see all that. They just really look at the fact that if you smoke, lung cancer is a thing that they worry about.
So if someone is watching this and is currently a smoker and interested in quitting, what can they expect from your program?
At ChristianaCare, we have quit coaches embedded throughout the system who can work with patients one-on-one and help them quit smoking over a series of sessions. And then patients are also eligible for free medication or nicotine replacement therapy. So that combination of the free counseling and the free medication is part of the Delaware Quit Line, but we offer it at ChristianaCare, and there's no charge, and it is the best available treatment to help people quit smoking. In addition to these outpatient services, we also have an inpatient program where we treat smokers in the hospital at a teachable moment while they're here, and then we follow up with them post-discharge to help them get connected to care once they're home.
And some people may be watching and thinking, I'm just going to go cold turkey, I don't need help, but it seems like this is leaps and bounds better than maybe trying it on your own.
Sure, and it's near Thanksgiving time, but people tend not to want to try cold turkey and aren't as successful because if they do meet with a coach usually can help them lay out a plan, pick a quit date, examine some of their triggers, and they'll be more successful working with a coach than trying cold turkey. When they try cold turkey, they get disappointed that they feel like that they made some progress, and then when they pick up a cigarette again, then they feel like a failure. So we don't encourage cold turkey. We encourage them to see a coach and have a coach help them.
And if someone is a smoker and happens to be either an inpatient or an outpatient, does that patient need to come speak with you, or could a family member or a friend who's involved in that patient's treatment speak to you?
Well, we like the patient really, or the person, to come forward and agree that they're ready to quit. I think this is important, that they need to be really engaged in quitting at their own pace. If a family member or a neighbor or somebody's concerned, they usually can find out a little bit more about the program and be almost like a support person for them. But it's so key for the person who is wanting to quit, because it's such an addiction that sometimes individuals don't think of it that way. They just say, why can't they quit? But we encourage the person who's going to be involved in trying to quit to really ask for help and really be a part of that.
And Denise, do you see that same process for inpatient?
Sure. A lot of times, family members are like, what can I do? What can I do? So we have them, while the patient's in the hospital, get rid of the person's cigarettes. They can be supportive in that way, or, get rid of the lighters, make the house as smoke-free as possible. If they're a smoker themselves, they can, try to quit smoking. Any Delaware resident can participate in the Delaware Quit Line to quit smoking. So those are things they can do, but again, we don't want them to nag. We want them to listen and let the smoker tell them how they can best support them in their behavior change.
And is there any specific way that your program approaches those patients that are maybe coming to you but don't believe it will actually work or don't really want to be there?
Sure. I mean, like I keep saying, this is an evidence-based program. So there's lots of research to show that this is the best approach. So if you really want to quit smoking, your best chances, you can triple your chances by using a trained tobacco treatment specialist that we offer at ChristianaCare in combination with medications that will help relieve the nicotine withdrawal symptoms when you quit smoking. And some of the newer medications you actually start while you're still smoking, and then they produce a negative effect. So as you take a puff of a cigarette, it doesn't produce the pleasurable response you normally get, and then you have a negative effect of smoking, and that often helps people put the cigarettes down. So we have lots of different approaches, and your coach will work with you to find what's best and address triggers and substitutions, and it's really a very holistic approach.
That's great. And who qualifies for these specific programs?
So in Delaware, we really have a robust program and have looked across who needs the program. 18-year-olds, students that are at the university that are here in town, military, and now, most importantly, 13 and older can get support for quitting, but just cannot get the approved FDA medications. So those categories of individuals can meet the criteria. If they're insured, it doesn't matter. We really are supporting the idea that we have to get people to quit smoking.
And I can't obviously let you go without talking about COVID-19. It seems, especially since COVID affects the lungs so intensely, that this is a perfect time to quit smoking.
Yeah, we think it's a perfect time, and we put out a lot of literature about what COVID, you don't want to be in a COVID situation and be smoking or be a smoker. So we're encouraging people to quit now, stop now, do it now. But there's some concerns for people, one being the fact that it's very hard and stressful to make a change. And this is a lifestyle change for a lot of people, and it's going to take some time. They're also a little bit of fearful still, and we're trying to reassure people that our system is safe. We're encouraging people to go back to their primary care. We are implementing all across our system the effective use of PPE. Denise and I, both as coaches, have seen people already where we're socially distancing. We're doing their own face-to-face visits. We're wearing our own masks. We're wearing what we need to wear. We're washing our hands. We're doing screening before they get here to assure, or right at the door to assure that they don't have a temperature. And we as employees are doing our COVID screening also to assure that we're not exposing them. So there really isn't a reason not to try to quit during this time. But if you're afraid of coming face to face, Denise, your suggestion you made to me earlier was then use the telephone. If you don't want to do the face-to-face, the Delaware Quit Line will set you up with the 5 telephone sessions and mail your support meds to you. So, hey, it's right there in your home, radically convenient. At least try. Don't wait for COVID to be over to try to quit smoking. It's just not the right thing to do.
And if you have slipped, we are seeing a lot of patients in the hospital who were former smokers that now during COVID, because of boredom or anxiety or stress, have gone back to smoking. It's never too late to quit. It can just be a slip, and we're here to support you to get you back on track, because now more than ever, it's important to quit smoking, given the risk of severity of illness from COVID if you are a smoker.
Absolutely. And how can someone book an appointment with you?
So there's one of the best ways, if you really want to attach to our website and go to ChristianaCare's www.ChristianaCare.org. The other way is to call our community outreach number that will get you directly to a schedule, which is 302-623-2273. And you can arrange for your face-to-face visit. If you want to see another coach more convenient to your location, I will facilitate that. If you make that first call, we'll make sure if it's closer for you to visit with Denise, we'll get you hooked up with the right coach closer to where you live, but face-to-face. So we're here to help you. Let us help you quit.
Fantastic. Well, Nora and Denise, thank you so much for that information. And if you're watching and would like more information on this program and to get involved, visit ChristianaCare.org.